The latest we received from the Department of Health, both national and provincial, is that our infection cases as of this morning stands at 20 persons. And the recovery rate is at 50% of that 20, which means it's 10, all tested negative. And we are also proud to report that our good president of Netfall South Africa has fully recovered also. Hospitalization is still at 1 and no death cases so far. Perhaps MEC, I should also report on the districts as to how are we doing district by district. The most concerning district for us, ladies and gentlemen, is Waterberg, with 11 cases, and Capricorn is number 2 with 5. Ordinarily, you'd have expected Capricorn to be more than Waterberg, but Waterberg is 11. I was saying to the Commands Council the other day that maybe it's because of the scenic beauty of the district of Waterberg. Everybody from outside, because these cases, most of them are people who have been visiting outside or who are visiting our province. And Mopani, we only have 2. Bembe, we've got 2. And Skukune, we are still at 0. And I'm sure that as long as we join hands together, there's no ways in which we cannot defeat this virus. We will defeat this virus. We've got no option. The only option is win or die. It's not win or lose. A loss means death. So we can't afford to lose.
We currently have 50%, 100% recovery. Those that have now tested negative from the 20 that had tested positive. Now, if you analyze each and every one of those, all of them are healthy. They are not old. That's what we must remember. So meaning many of us who are healthy, who don't have any comorbidity, which is those of us who are living in an affluent area, people like me and you, chances are we will get this virus, but our body will weigh it off. But once it hits the township and the villages, those are the people who will not be able to fight it out because they also have got other comorbidities. They are diabetic, they are hypertensive, and we still have got patients that we have not even diagnosed to be HIV positive. Those who we have diagnosed, who are on ARVs, the viral load controlled, we have noted that they are not really hard hit. They are able to fight it back because they are already, some of them, on ARVs for that. But those whom we have not yet even diagnosed and are sick at home, once the virus gets to them, we will start counting a number of deaths in the province. So that is why we're saying to our people, we're doing all this to make sure that we save their lives. We can't win this battle in an ICU or in the wards, in the hospital. We will win it on the street. And that's why you see our premier leading us every day from 6 in the morning to 6 in the evening, moving from one village to another, from one taxi rank to another, from one shopping mall to another, because he knows this is the only way we can deal with this virus, winning this battle on the street. And I think if people can respect that, to say, as a province, we came up with all this for us to be able to win this. We don't have resources. We don't even have a single central hospital here. If you look at the number of specialists, you go to one hospital, they've got just one hospital. They are more than all of us in Limpopo combined, all the specialists in Limpopo. So it's not going to be the same. So we are appealing to our people to really listen to us. So the appeal is to say, we're having challenges with these protective clothing, especially the mask. Our priority will be our health workers. They must have what we call the N95 mask, which is a more highly protective. That one, anyone who's treating any highly infectious disease must be wearing the N95 mask. So when we meet people in the mall putting it on the neck, It pains me because I don't even have that particular stock, Premier, and people are putting the N95 mask on the neck. Please, we don't have them. So the surgical mask also, when you're wearing them, you must remember that when those who are working in the clinics and hospital, every time when each patient come in, they must be able to wear and change the mask regularly. We use surgical mask in our hospital like you would use a toilet paper at home. Every time we must be using it and throwing it. I hope that would be understood. So when the situation becomes very tough and difficult, we will be requiring all those masks, and let's not really be wasting them, because what I see happening, we're just wearing them for the sake of, we want to feel some sense of security. Let's wear them if indeed there is a reason why we should wear. If any of one is coughing, you must wear a mask so that you protect all of us.
The virus doesn't have legs. We are the ones who have legs. The virus doesn't have transport. We are the ones who are transporting the virus. Ladies and gentlemen, we still call on Limpopo people to abide by the lockdown rules and assure them that wherever we go with the law enforcement agencies, we will take action if people don't abide.